on YouTube. And we'll get started in 1 second. All right, we'll get started, guys. Thanks for joining us again for a COVID-19 media briefing. Today is Tuesday, September 1st. Today we'll have remarks from Medical Officer of Health, Dr. Hsiu-Li Wang, and I'll also provide a brief enforcement update. And then we'll take your questions. So over to you, Hsiu-Li, go ahead.
Thank you. So the overall status of COVID-19 in Waterloo region remains relatively stable. As of this morning's dashboard update, there are 42 active cases. In the month of August, we have reported 70 new cases, which is our fewest cases per month to date. A total of 70,280 tests have been performed in Waterloo region with positive results for approximately 2.1% of all tests. There is currently 1 new outbreak declared in long-term care and 1 outbreak in a day camp that was reported last week. The previous outbreak in long-term care has been declared over. There are no new cases associated with the day camp outbreak. There are no new outbreaks in retirement homes, other congregate care settings, or workplaces. We have also updated the key numbers on the landing page of our dashboard to include the number of all active outbreaks. Previously, these were just those in long-term care and retirement homes. Last week, we received the school outbreak management guidance from the province, which outlines how local public health units will investigate cases, outbreaks, and suspected outbreaks in elementary or secondary school settings. This was a welcomed update. The guidance outlines the role of health units, which includes advising school boards on COVID prevention and preparedness, case and contact management, outbreak assessment and management, ongoing local surveillance, otherwise known as monitoring of cases. In a school setting, an outbreak is defined as 2 or more lab-confirmed COVID-19 cases in students and/or staff or other visitors, where there is an epidemiological link between the cases within a 14-day period. So this means we are looking for a connection between the 2 or more cases, where at least 1 case could have reasonably acquired their infection in the school setting. An outbreak will be declared over if at least 14 days have passed with no evidence of ongoing transmission that could reasonably be related to exposures in the school and no further ill individuals associated with the initial exposure who are awaiting test results. As part of our role with outbreak assessment and management, public health will provide guidance on outbreak control measures, provide recommendations on isolation, partial or whole school dismissal based on the scope of the outbreak. Whole school dismissal may be considered if there is evidence of potential widespread and/or uncontrolled transmission within the school. We would also make recommendations on who should seek testing and conduct on-site investigations in the school as needed. In addition to recruiting and onboarding additional public health nurses for schools, we have been supporting our local school boards as they prepare for school. One of our directors, for example, has been acting as a board-level liaison, including weekly meetings since the beginning of August to discuss issues and triage questions. We have reviewed return to school plans with each school board, including both French boards, private schools, and parochial schools. We have developed a resource package for private schools to add to the Ministry of Education's guidance for public schools. We have created resources to assist with the management of positive cases and outbreaks. We are developing tools for parents and school staff to aid in decision-making regarding symptomatic staff and students, and we have updated our website with information for parents, including frequently asked questions. We are creating kid-friendly resources for face coverings, hand washing, and hand sanitizer, and we have developed an infection prevention and control checklist for schools and are beginning our visits to schools this week. In closing, we have made good progress because of everyone's efforts to date. As families prepare to return to school, it is essential that we all keep practicing the public health measures of physical distancing, hand hygiene, and wearing face coverings. It is also essential that we continue to be smart about how we socialize with one another, knowing the risks associated with gatherings in enclosed places or crowded environments. Please continue to practice physical distancing with everyone outside your social circle and look for opportunities to gather outdoors where you can easily maintain physical distancing to reduce the spread of COVID-19. The more we keep our infection rates low, the lower the risk for all the sectors that are reopening or continuing to open up further, whether it be schools, businesses, or congregate care settings. We all have a part to play. Thank you very much for all your efforts.
Thanks, Hsiu-Li.
That's it.
All right, I'll give a brief update on enforcement. So public health in the last week ending August 30th, public health had 47 complaints and or requests. So they provided education and sometimes warnings in all cases. And in one case, they had to do a site visit, but no fines or enforcement action was required. Specifically on the bylaw, on the face covering bylaw, in the last week, bylaw staff received about 75 questions and complaints about the mask bylaw. They did 5 site visits and no charges were laid, no enforcement action required. So if you need any follow-up information on that, I can provide it. And I think I will turn it over to you guys for questions, and we'll start with Joanna from the record. Go ahead, Joanna.
Thank you. Dr. Wang, I'm just wondering sort of how you're feeling on the eve of schools reopening. Are you nervous about it, or do you think we're ready?
No, I'm very appreciative of all the efforts that the school boards and schools have made in challenging times when they've had to receive information, and have had relatively short periods of time to implement them, and doing their best to keep up with both updated guidance that comes their way, as well as communicating with parents and their staff. So it's obviously been a challenging time for schools, and I really appreciate all their efforts. I also know it's been challenging for parents, and again, they have shown a lot of patience, and they've asked good questions, and we're trying as much as we can to respond, the school boards and ourselves, to respond to the questions that they are submitting. So I feel overall that there's been very good efforts that have been made. We understand that it is an anxious time because this is the first time we're reopening schools after we've experienced the first wave of this pandemic. I feel like there are good measures that are being that are being put in place in schools across the region. And I'm also happy to see that our residents, by and large, continue to practice the measures that we've been recommending so that we can continue to keep rates of infection low because this will just help keep a potential spread of COVID-19 in school settings low as well.
And so we had a really good August. Are you concerned then that September is going to see like a rapid increase in case numbers? And sort of a related question, when do you expect to start seeing cases related to kids going back to school?
So that's a very good question. Yes, I do expect that, as we continue to open up society, including schools, and more and more businesses sort of reopen or expand their openings within the parameters of the current stage 3 legislation, we will see increasing numbers of cases. That said, what we are striving for is to minimize the number of cases as much as we can, and of course, minimize severe outcomes from cases. And the best chance that we have to maintain low rates is if everyone pitches in and does what they can to implement those public health measures that are within their control to implement. And another important thing will be, that we continue to keep the community updated on how it's going, and what actions they should continue to take to continue to try to keep our disease rates low. I'm sorry, I think I might have forgotten part of your question. You had asked about, am I expecting it to go up? Yeah.
And when, basically?
Oh, right, when we would expect. Well, generally we would start seeing some indication about 2 weeks after, things have started to open up more. So in the 2 to 4 weeks afterwards, that's when we should be expecting an increase. It could start earlier than that, but in the 2 to 3 weeks after an increased opening, that's when if there's been an increase in cases, that's when we would generally start to see the effects, most evidently. Sorry, so start to see the effects in a more evident way. That's it, yeah.
And will the outbreaks be reported on the dashboard along with other outbreaks?
Yeah, so outbreaks and cases will be reported on the school board's websites. And so we will be coordinating with them so we can ensure that, we link to their sites, and we're not going to be duplicating efforts. So they're required to post about cases, about outbreaks. So we'll be working with them to make sure that information is available for members of the school community and the public.
Okay, so just on the school board site, not on the dashboard.
Yeah, we would link on our dashboard to the pages on their websites where people can find this information. We're still going to work. We're still in the process of working out the specifics, but we're going to try to make it really, easy for people, so there's sort of a no wrong door in terms of where they can get to this information.
All right, thank you.
Thanks, Joanna. Let's move to Samantha from CBC.
Hello, I had a question about back to school as well. A lot of parents have been asking us in particular, or telling us that them and their kids will have, serious their mental health will suffer about going back to school. And I was wondering what your thoughts are on that, and how parents can deal with that, especially with their kids going back to school, and with some of them having particular needs like ADHD and other special needs. Thanks.
Right. No, thanks for the question, Samantha. So, there's been a lot of assessment by pediatricians and other experts who care for children about the effects of COVID on on them, including the effects of school closures. And as you may be aware, groups like Sick Kids have put out some recommendations and have, really informed the province's plans, which call for, as much as possible, bringing kids back into the school environment to address some of the issues that they've seen, including with, mental health and such, when kids have been out of school for too long. Understanding that there now can also be the opposite effect, where the idea of returning to school can be anxiogenic for some students and their families, and it's understandable. Those would be situations where I would suggest they continue to speak with their healthcare provider, who can sort of assess the family situation and try to assist them with ways that they can cope with some of the stress associated with returning to school. And I think as we get more experience with the return to school, and it becomes a bit more normalized, some of that anxiety may get may start to decrease a little, just because of the fact that we are all more anxious when things are new and they're more unknown, and when we haven't seen what it could look like tangibly. So I think they should continue to speak with their healthcare provider, and just speak with their children, and it's good to, I think, talk about some of the concerns and fears and discuss them openly.
Now, my other question was, cities like Toronto have done data analysis on hotspots, and I know that the school boards there have put in special measures for students who live in these areas and communities that are high risk and highly affected. I was wondering if there was anything in particular being done in the region for these schools.
Yeah, so we have a similar map like the City of Toronto on our website under mapping. We do not have the population that the City of Toronto has, right? Or the health unit covers, like, I think it's 3 million. So, we don't have the amount of cases either that the City of Toronto would have. So, when we've looked at our data, what we found is the most significant impact in wave 1, in large part because of the limited testing in the early stages, was associated with outbreaks. And so outbreaks really were very predominant in terms of where the cases showed up. And it's not where the outbreaks happened, it's where the cases who were associated with the outbreaks live. So that's how it's mapped, in all health unit areas, because that's the data we have. We get the data, where the people live. So I would say that what we've seen with our mapping is that there is some moderate to low level correlation with neighborhoods that have lower income, that have more recent immigrants, but the correlation is not strong. So we have a number of neighborhoods where that correlation doesn't exist, or it's even inversed. So it's not the same situation where we have neighborhoods that we can say, oh, you definitely at increased risk, and you're going to continue to be at increased risk. And if that's the case, it's often associated with the factors that are outside of the school environment, right? It's associated often with factors like low income and things like that. So it's not within the school environment. So I think it's important that across Waterloo region, all our schools have good measures, and that the work that the region has done and continues to do, trying to address what we call the social determinants of health, you know, the factors like income and education, et cetera, that put certain populations potentially at higher risk for health issues, including COVID, that those also continue to be addressed in parallel. So I think the risks that are associated with schools depend on the school environment. And so it's important that, I think across the board, that we put in the measures that we think we should for all the schools in all the neighborhoods.
Just one quick follow-up. If there is a spike, or you said that you expect to see, you know, more numbers and cases, that if there is a spike or an outbreak at a particular school, have the health unit thought about what kind of considerations and measures that would be put in place for a specific school in a certain area?
Yeah, for any specific school, the immediate actions would be to ensure that for all those that you know, we would recommend testing, that they have good access to testing. So we work in close partnership with our assessment centers, and you know, they're at the ready, and they've been preparing for potential increased numbers of cases. And so, you know, that would be the more immediate impact. As we've seen, COVID can spread in any environment. The cases of COVID can go up rapidly in any environment. It's not that in neighborhoods where there's a higher proportion of those in low income, for example, that have more recent immigrants, have a higher risk of having an increase. It can happen anywhere. And so we in terms of our plans would be to ensure that, you know, all kids, all staff, and all schools that may be experiencing an increased number of cases have rapid case and contact management, which is done by public health, outbreak measures that are put in place rapidly, which is again recommended by public health, and access to testing, which is done by our partners. So we would help facilitate, where needed, access to testing, for example, for those members of the school population that were affected. So it's a lot about the rapid mobilization of public health measures and testing for those groups that would need it.
Okay, thank you so much. Those are all my questions.
Thank you.
Thanks, Samantha. Let's go to Damon from the Woolwich Observer. Go ahead, Damon.
Hello. So my first question is there a point in time where we're seeing outbreaks in schools that it's decided that, hey, we need to shut down school in the region completely and switch to the virtual?
Yeah, that's always a possibility. We would likely see that if there was a sense that there was uncontrolled transmission in multiple school settings, that really the typical actions that we take to address any outbreak, which would be very similar in a school setting, are not able to bring these outbreaks under control and in a relatively appropriate amount of time. And there's a sense that the transmission is uncontrolled or widespread enough that a broad measure like closure of schools may be necessary. You know, that ultimately may be necessary, but you know, it would have to mean that very significant efforts that we would make to try to address outbreaks as they occur, as we've been doing since the time the first wave has been going down and throughout the summer. It would have to be that such measures would no longer be sufficient, right? And we would see that, you would see that with increasing numbers of cases, increasing numbers of outbreaks, in a sense that the measures that are being put in place are just not sufficient in controlling those. So, you know, that might always be an option, but we hope not to implement that option, obviously.
Okay, then my next question isn't related on the on the dashboard, when you look at percent ever hospitalized, for hospitalized in ICU, for the cases, it's mostly non-outbreak related, 53 compared to 7. What would you equate that to?
Well,
Hello.
if you look at the fact that most of our cases are not hospitalized, that's why most of our cases do not end up in ICU. And for example, if you look at our number of deaths overall, it's also a percentage. I think it's 9% overall. So it's most people who have COVID do not require hospitalization, and it doesn't lead to severe outcomes or worse for them. That's what I would attribute to. I don't know if I'm answering your question, Damon.
Not really. I'm kind of wondering for like long-term care and retirement homes, why those numbers aren't larger compared to the community numbers.
Why those numbers aren't larger?
For requiring ICU treatment.
I'm not sure that's the case. What we've seen is when people are in a particular age category, say 70 and up, they have had more severe outcomes in general, right? Or they've been more likely to have more severe outcomes. And so, but even in that group, it doesn't mean that most of them would be associated with hospitalizations. Like even in our outbreaks in long-term care and retirement homes, when we have cases, it's not that most of them are hospitalized. It's most of them are still in the homes and can be treated in the homes. So it's still a minority of cases that need to be hospitalized.
Okay. And then just a question for Bethany. I didn't catch the first number. The Wi-Fi just glitched out when you're listing out the fines and whatnot.
Sure. Are you asking about face covering bylaw or just the general face covering? I'll read it again. I can read it again. I can send it to you too. So public health had 47 complaints and or requests, and they provided education in all cases and 1 site visit, but no charges. Specific to the face covering bylaw, there were 75 questions and complaints, 5 site visits, no charges, no enforcement action.
Perfect.
Okay.
Thank you so much.
No problem. Let's move on to Mark from 570 News.
You pretty much covered all of my back to school stuff, so I'm good. Thank you very much.
Perfect. Thanks, Mark. And over to Nicole from CTV.
Hi, good afternoon. So the definition of outbreaks, 1203. The definition of outbreaks is different from schools compared to long-term care homes, childcare settings, and day camps. Does the local public health have the authority to make our outbreak protocols for schools stricter, lowering it back down to 1? Because I'm hearing some confusion from people as to why the definition for schools from the province is different, and they'd like to see something similar in regards to long-term care homes and the other settings.
Yeah, so I think some contextual information to be aware of is that traditionally outbreaks is defined exactly the way that it's defined in the school outbreak guidance, 2 or more cases. Because for example, you could have a child who gets COVID, or didn't get it in the school environment, wasn't in the school environment when they were infectious. It wouldn't make sense to declare that environment as having an outbreak. So if you ask from a public health perspective, what it makes sense to use as a threshold, that definition makes sense when you have evidence to suggest that at least 1 child among 2 or more may have acquired the infection in the school setting. We do that for hospitals. We do that for hospitals with ICU beds. We do that with, generally care settings outside of the ones in which the government, the Ministry of Education has lowered the threshold to 1. So they themselves, so this is the same ministry setting the thresholds for daycares, day camps, and schools, and they have set the threshold for daycares and day camps to be lower, as you know. That doesn't mean that there's no action taken when there's one case. As soon as there's one case, there's public health action that's taken. So for example, if there's one case, the entire class could be dismissed. So as soon as there's a case, there's public health action. Right away, we do case and contact follow-up. And as you can see in the school guidance documents, generally, there's also a dismissal of the class until such time as we can, confirm that we don't have evidence of ongoing transmission. So despite the definition of the outbreak, which from a epidemiological public health measures perspective makes a lot of sense, the actions start whenever there is a single case. So hopefully that provides a little bit more information, to sort of answer that question about, does this mean we would be waiting longer to action anything? We would not be waiting longer to action anything.
I guess my question would be then, do you have, as the local authority, to lower that threshold down to 1?
So a local authority, yes, there's always local authority when we feel that there is a significant local threat that needs to be addressed that isn't covered by guidance. This outbreak definition is very reasonable to me. And again, it is not the threshold for action. The threshold for action is one case. So I wouldn't see a reason to lower the outbreak threshold. Overall, I find that the guidance for case contact and outbreak management is pretty conservative. And that's appropriate because we want to have this precautionary approach as we start to open schools for the first time. So the measures are going to be very conservative, and they're going to be prompt.
So obviously everyone's dealing with back to school and their plans. Speaking to an academic yesterday, she suggested backup plans need to be in place.
Yes.
In terms of speaking to employers when outbreak, in the event of an outbreak, or reconsidering family gatherings when school starts, so that those who are vulnerable within your extended family are potentially exposed. Can you just, I guess, reiterate, provide even further guidance in terms of such backup plans?
Yeah, no, that's a great question, Nicole, because it's true. Because of the type of guidance that's been provided for case and contact management in schools, which I mentioned is very conservative, and it involves, potentially dismissal of entire class as soon as there's a case. It makes a lot of sense for parents to be prepared for having to make backup plans for their children, because it could happen anytime. That an entire cohort would need to be dismissed from class, and is not immediately clear when they would be able to return either. So having those backup plans, is really good preparation. In terms of social circles, what we recommend is people continue to try to limit their social circles where they can, right? The current guidance in Ontario is 10 or less for your social circle. And for some families, because their children will be going back to school and therefore their children's social circle is being extended, they may wish to further decrease their own social circles to decrease the number of people overall in the multiple social circles that their family members interact with. So I just in general encourage that people look at their individual situation, and it will be an individual family decision on what is best for them. But in general, we should try to continue to limit our social circles. Just because school is opening up again doesn't mean that we can expand our social circles to the numbers, in the class or cohort. We have to keep to those small social circles as much as we can. And just because the gathering limits, for example, indoors and outdoors, have been increased to 50 and 100 respectively, again, doesn't mean that we should be having close contact with that many people, especially in indoor environments. We should be still maintaining physical distance and still trying to avoid closed and crowded environments.
My final question has to do with the younger people who have tested positive. I see that there were 21 kids under the age of 9 since the pandemic who have tested positive. I haven't checked in terms of between 10 to 20, but are you able to provide an overall, I guess, what they have gone through, those children, and if those children spread the virus to others?
Okay, no, that's a good question too. So yeah, in terms of numbers overall and percentage overall of cases, those under the age of 20 represent a small proportion of our cases. We also have seen, when we look at the evidence more broadly, across the world, including in other settings where schools have reopened, what we generally have right now as evidence is that younger children, those that are under the age of 10, tend to be less at risk for infection, for severe manifestations, as well as appear to be less likely to transmit the infection. So there's a lower infection and transmission risk that's associated with younger age groups, such as those under the age of 10. So that's what the evidence is saying so far. And that's also why the recommendations that have been put out by the Ministry of Education for schools is different depending on whether it's an elementary, whether it's about elementary grades versus the high school grades. So for the children between, older than 10, or the young, the youth older than 10, what we've seen is they generally have transmission that appears to be more like the adults. So that's why, again, there's different recommendations for children under 10 versus children over 10 and in different grades. And so that's one of the reasons the recommendations are different like that. So we'll have to see, we'll have to continue to see what happens after school reopens, and if we see changes to the evidence, then we have to update our recommendations in line with what we see as changes.
Okay, that's it for me. Thank you.
Thanks, Nicole. All right, I will give everyone a final chance to ask any follow-up questions. Anyone want to wave at me? No. All right, that's it then. It's 12:15, so thanks everyone, and we'll see you next week. Thanks for participating.